Hello all, greetings from Kerala. I hope that you are having wonderful time in this conference. I wanted to be with you in this conference in person, but I'm sorry that I could not make it this time due to a prior commitment. It's always a pleasure to be part of the academic initiative of Dr. Pulla and team. Thank you for this opportunity. I'm glad to be a speaker in this international conference towards building a positively responding society and nation, jointly organized by Guru Kasidas Mahavidyalaya, Brisbane Institute of Strengths-Based Practice and IHM Australia. I am Dr. Anish Kayar, Associate Professor, Department of Social Work, Rajagiri College of Social Sciences, Kerala. Today, I would like to speak on a very important topic, a social work intervention model for addressing youth mental health and behavioral addictions. Now, let us begin by sharing the screen. I'll be talking about this topic, a social work intervention model for addressing youth mental health and behavioral addictions. The agenda is, we'll be first setting the context of the presentation, the model proposed, and also implications for social work. Now, looking at the context of this problem, we know that the challenges faced by youth are enormous these days. There is rising rates of mental health concerns, especially anxiety and depression among youth, increasing behavioral addictions like increased screen time, gaming addictions, social media overuse, etc. is causing potential trouble to youth in this day society. Now, the impact is basically on the emotional well-being, academic performance, and their social relationships. Now, how we go forward? We need to have a holistic, strength-based approach to deal with this issue. That's the context of this presentation. Now, let me come directly to the model. So why this model? It's very important to see why a model like this is to be introduced. Now, we know that the traditional approaches might not be addressing the multifaceted nature of the modern challenges. Now, we need to integrate prevention, early identification, and community support into the intervention for substance abuse and mental health concerns among youth. There are enormous evidences which shows that early intervention can mitigate long-term issues, especially with regard to mental health concerns. A strength-based framework enhances resilience and self-regulation among the youth. So what are the underpinning theories behind this particular model? The primary theory which I have used in this model is basically deriving from the prevention principles. We are all familiar with the levels of prevention. Here, our focus is primarily on primary prevention or promotion of mental health, as well as early identification of mental health concerns. In primary prevention, we focus on how we can reduce the occurrence of problem, how we can prevent the occurrence of mental health concerns or screen addiction or behavior addictions. Or in the secondary prevention aspect, we will focus on how we can early identify and treat the problem so that the problem does not become a serious problem. That's the first focus. But if at all we are not able to control at the primary or secondary level, we need to have an idea for how to tackle issues which has already evolved. Now, we will be using a strength-based approach where we focus on existing assets, basically the social competence, resilience, and such assets have been utilized for intervening with our youth. And we also need to encourage them, learn how to self-regulate, how to set goals and progress in their life. That can definitely help them to work on their own mental health as well as substance abuse and behavior addictions. So we need to integrate the principles of social work, especially empowerment, collaboration, and respect for individual strengths. That's very, very key in our intervention model. The core components of the model includes primary prevention. That is, we can have psychoeducation programs in schools and communities, life skills education programs, and also primarily we have to demystify the concept of mental health itself, because there is a lot of the stigma attached to mental health concept. So that also will form one of the very important intervention in the primary prevention. Now we come to early identification. We have to adopt screening and assessment strategies so that we are able to identify these issues early in the stages. For example, mental health conditions like depression, anxiety, or behavior addictions. Before it becomes a bigger problem, we can identify through screening activities. So that could be another focal area of this intervention model. And third is, once we identify that, we have to have structured counseling and behavior modification techniques so that people are able to get rid of or get out of these mental health concerns. So that is intervention model. Now, we cannot do any intervention without having a proper community engagement because we have to build supportive ecosystems. the ecosystems which are supportive in terms of the family, the peers, the community resources, or the workplace, everything need to be addressed so that the mental health of the people or youth in those contexts becomes essentially good. Now, we also need to focus on collaboration. We have to involve mental health professionals, educators, peer group, workplace colleagues. All are our stakeholders in the process. So we have to involve them also in the journey of recovery. Now, the intervention strategies, we have already discussed psychoeducation, educating them about the consequences, the possibilities, problems with regard to these type of things we need to understand. We can do life skills education, which can be a promoting intervention with regard to core life skills or WHO. Where if you train people on WHO core life skills, they can develop a lot of skills like problem solving, decision making, critical thinking, creative thinking, or their coping with stress and emotions. All can be managed very well by people. So a lot of mental health problems can be prevented if they possess good life skills. Now, we also need to enhance the capacity of teachers, counselors, and parents, all the stakeholders, so that they all play together, work together to help our youth to get out of this mental health menace. Now, peer support programs are prominent. Structured counseling sessions also can be planned. Behavior modification techniques can be adopted. Digital detox plans, which we can adopt with people with substance abuse or behavior addictions, so that we can help them to come out of those things. Then you also have to have interventions to enhance their self-awareness and stress management. As we know that skill building workshops makes a very important part of our intervention. We need to focus on their social competence and their self-regulation skills so that they are able to manage many of the concerns by themselves. Now, without family support, no intervention can be effective in a collective culture like India. So we have to develop intervention strategies which will develop the strengths of our families, competencies of families, so that families become cohesive, families become the place where they can get a lot of support with regard to mental health concerns. That also becomes a very important part of our intervention strategy. Now, as social workers, we definitely believe in involvement of all stakeholders in intervention. So community engagement becomes a very important intervention where we need to strengthen the support systems involving families, schools, local organizations, so that there is a conducive environment for proper mental health of people. There are certain key strategies like community-based events and workshops, creating partnership with local mental health services, all becomes very important when we intervene in the context of mental health. Now, the benefits are, all these interventions can help in reinforcing positive behaviors, enhance social support, enhance sustainability and replicability of the intervention model. So when we have a process which is having all stakeholders involved becomes very, very important. Now you see that without collaboration of all stakeholders, no outcome can be obtained. So we need to have developed collaboration among mental health professionals, educators, families, and peer networks. Now, what are the outcomes of this intervention? Now, we understand that the outcomes are mainly improved emotional well-being, reduced symptoms of anxiety and depression, and other psychiatric conditions, enhanced academic performance and social functioning, positive changes in behavioral patterns, and reduced screen addiction and other behavior addictions. Now, this model can be replicable because it uses a comprehensive approach across various communities. And the evidence supports that it can be used in diverse settings. Now, what is the future direction? We need to do continued research and adaptation based on community feedback and new evidence. Now, how do we integrate this to the social work practice? So as we know that social work start with this rapport building or engagement, exploration, then we start mainly with assessment. So we need to understand wherever we are intervening, whether it's an individual client or a group of clients or an institution where we are going to do implementation of the model, we have to identify the needs and existing resources so that once we know that, we can plan accordingly. So we need to develop a tailored intervention plan based on the model. Then we can develop collaboration, identify the key stakeholders and develop collaboration with them. And we build multidisciplinary teams to engage the stakeholders, then execute our intervention. Once we execute that, we need to do the evaluation. We need to monitor the progress and outcomes so that we are able to institutionalize these interventions as well as make these interventions effective. So this can be very much integrated to social work practice. As a conclusion, I want to clearly state that addressing youth mental health and behavioral addictions requires a holistic and multidisciplinary approach. The model integrates prevention, early identification, intervention, and community engagement. By focusing on resilience building and leveraging community support, social profession can foster positive outcomes. This model provides a replicable framework for supporting holistic youth well-being. Thank you so much for patiently listening to me. I would have loved to be there, but I believe that this presentation was beneficial for you in some terms of discussion. Thank you so much.